In the bright and well-organized conference room of a public health office, adorned with posters about community health initiatives, two healthcare professionals, Dr. Emily and Dr. Mark, gathered around a large table. They were preparing for a workshop aimed at increasing vaccine awareness and uptake among local residents.
Mark, as we get ready for this workshop, I'm reminded of how essential vaccines are in preventing disease and protecting public health. The science is clear, yet we still face significant challenges in vaccine acceptance. What are your thoughts on the most pressing issue we need to address today?
You're right, Emily. Vaccines have transformed public health, but hesitancy remains a big hurdle. We need to understand the roots of this skepticism to effectively counter it. In your experience, what do you think is the most critical factor contributing to vaccine hesitancy?
It's a multifaceted issue, but let's delve into it. Question: Mark, based on your interactions, what do you consider the biggest challenge in overcoming vaccine hesitancy? A. Misinformation and lack of understanding about vaccine safety. B. Cultural beliefs and practices that conflict with vaccination. C. Accessibility and availability of vaccines.
Answer: A. Misinformation and lack of understanding about vaccine safety.
Mark, I believe misinformation and a general lack of understanding about how vaccines work and their safety profiles, option A, are at the heart of much hesitancy. Combating misinformation is crucial. We need to provide clear, accurate, and accessible information to dismantle fears and build trust in the vaccination process.
Absolutely, Emily. Addressing misinformation effectively requires us to not only provide facts, but also to engage empathetically with the community's concerns. People need to feel heard and supported in their decision-making.
Exactly. It's about fostering a dialogue that respects individual concerns while educating on the broader benefits of vaccination for community health.
As their discussion continued, Dr. Emily and Dr. Mark strategized about the best ways to use educational materials and community engagement to improve public perception and acceptance of vaccines.
Emily, besides misinformation, another challenge we face is integrating cultural beliefs and practices in our vaccination campaigns. How do you think we should address this aspect? Question: Emily, considering the diverse cultural backgrounds of our community, how can we better align our vaccination efforts to be more culturally sensitive and inclusive? A. Tailor communication and education efforts to reflect cultural values and norms. B. Stick to a uniform public health message to avoid confusion. C. Focus primarily on scientific data, minimizing cultural considerations.
Answer: A. Tailor communication and education efforts to reflect cultural values and norms. Mark, addressing cultural diversity is vital. By tailoring our communication and education efforts to align with various cultural values and norms, option A, we can foster a more inclusive approach. This means not just translating materials into different languages, but also using culturally relevant messaging and engaging with community leaders to endorse vaccination.
That's a strategic move, Emily. Getting community leaders on board can really amplify our message and build trust within different groups. It's about showing respect for their beliefs while educating on the benefits of vaccines.
Absolutely. And by incorporating this approach, we can bridge gaps and reduce resistance. It's about building a comprehensive strategy that encompasses all aspects of community health.
As their conversation progressed, Dr. Emily and Dr. Mark discussed the logistics of organizing workshops and outreach programs that included culturally diverse educational materials and the involvement of community leaders.
Emily, beyond addressing cultural issues, we also need to consider accessibility. Many people are willing to get vaccinated, but find it difficult to access clinics or are unsure about the cost. Question: Emily, how should we tackle the issue of vaccine accessibility to ensure that no part of our community is left behind? A. Increase mobile vaccination units and extend clinic hours. B. Maintain the current setup, focusing on central vaccination sites. C. Limit outreach to high-density urban areas to maximize resource use.
Answer: A. Increase mobile vaccination units and extend clinic eating hours. Mark, enhancing accessibility is crucial. By increasing mobile vaccination units and extending clinic hours, option A, we can reach more people who might otherwise be excluded due to geographic or time constraints. Making it easy and convenient is key to improving vaccination rates.
I agree, Emily. We need to ensure that vaccines are not just available, but also conveniently accessible to everyone, especially in underserved areas. It's about equitable health access.
Right. And by addressing these logistical challenges, we can significantly boost our community's overall health and resilience against diseases.
As their meeting concluded, Dr. Emily and Dr. Mark finalized their plans for the upcoming workshop. They organized a series of community meetings, planned for the deployment of mobile vaccination units, and developed a range of culturally sensitive materials tailored to the diverse needs of their community. Confident in their comprehensive strategy, Dr. Emily and Dr. Mark left the meeting room energized and hopeful, ready to implement their plans and make a tangible difference in public health within their community. Here are 5 key concepts related to the theme of the essential role of vaccines.
Misinformation and education, combating vaccine hesitancy with accurate, clear, and accessible information. Cultural sensitivity, tailoring vaccine communication to align with cultural values and engaging community leaders.
Accessibility, ensuring that vaccines are easily and conveniently available to everyone, especially in underserved areas. Community engagement, fostering trust and dialogue within diverse communities to promote health and vaccination.
Public health strategy. Developing a holistic approach that addresses misinformation, cultural diversity, and accessibility challenges.